Okay, so my name is Nicole Morrison. I have been a registered nurse for the last 17 years. I have worked in a number of different areas. I started off in labor and delivery, and when I graduated, I moved to California and started in a travel nursing position down in San Diego. So initially, I thought I was going to be a hospital nurse. I loved working with the postpartum, the pregnant, the laboring clientele. And so that's where I initially started. But our hospital was the closest hospital to the Tijuana border. So our primary population that was served were actually mostly women coming across the border to try to deliver their babies in the States, to open up citizenship options. We had a very high rate of women delivering that were working currently in the sex trade, which is much more sex for survival down there. We had a high instance of substance abuse, domestic violence, as well as adoption. A lot of these babies were left. We were a safe drop hospital, so no questions asked, kind of no challenges. If someone wants to leave a baby, to ensure newborn safety, we have safe drop hospitals, and we were one of those. So we had a lot of babies that were left with us as well, and then would make their way into the foster system, the CAS system, and then find other homes. So what I quickly learned was that although, all of my labor and delivery skills, my IV initiation skills, how to do the like CPR if you need to and resuscitate a newborn, those are really meaningful and important skills to have. What I graduated with wasn't a clue on how to talk to someone about sex trade or refugee status or domestic violence. So in hindsight, there were many missed opportunities as a nurse to provide holistic care, because when you don't know how to approach a conversation, sometimes those conversations get avoided. So as a new grad, it took some time to learn, to figure it out, to get comfortable with the things that I wasn't comfortable with. And then I started to really grow a passion for that recognition that I not only need to have, hands-on nursing skills, which I acknowledge we all do, but we also need to know how to work with vulnerable and marginalized populations. Long story short, I traveled up to Laguna Beach. I've then worked in Hawaii. And now I've been home for a number of years, and I currently do this part-time. I've taught for over 10 years at Durham College. This course is my passion, my love. I really think that it's an important area for us to all explore together. And I also work part-time at a trans health clinic, hence the big flag behind me. So I now work with the gender expansive community to help break down barriers, open healthcare doors, and find folks access to gender affirming care, which is a really growing need in our area as well. So what I hope this course will do for all of you is, preemptively avoid some of that new grad challenge where you get out there and you don't know what questions to ask, you don't know how to kind of navigate some of these harder situations. We learn a lot in Potter and Perry and lab and our other courses about kind of the like nuclear family, the privileged family, the well-supported families, the people that are, married with jobs and families to support them. This course looks at the rest of the population, the people that don't have healthcare, don't have income, don't have safety in their lives, homelessness. Sometimes we don't even have food or like feminine hygiene supplies or socks for our feet in the winter. So my goal is to open your eyes, to get you to understand, or not understand, maybe you already do understand, but to get you to dig a little deeper into, as a nurse, how do we work with these populations? What resources are available in Durham? This course is different than your health and healing, where you're learning the theory. the concepts. This one is going to be more hands-on. You're going to explore what agencies are out there. How do I, have a debate about harm reduction and have some educated answers behind me to speak to this with evidence-informed decision-making? Start to think about if you were in the shoes of someone who may be homeless, experiencing poverty, experiencing discrimination in some way. Where do you find the resources to start to connect these people? So what I encourage you to do through this course, because I do this at the university and the college level, and I'm well aware some folks are never going to be community health nurses, and that's okay. My goal isn't to say this is where you need to end up, but I hope that through this course, as you learn, as you kind of explore perhaps your own biases or your own things that you bump into that might be, uncomfortable or challenging, is remember that wherever you land, whether you work in labor and delivery, emerge, long-term care, peds, whatever unit it is that you end up working on, you are going to have vulnerable and marginalized populations coming to those units. You're going to have people with domestic violence. You are going to have people with substance use disorders. You're going to have, kids that are struggling at home with abuse and with safety, with self-harm, with a number of different things. So the skills that we learn in this course, I think are really important because they're transferable. Wherever you go, these things are going to kind of find their way to you at some point. So the goal is to get you to be able to engage in these conversations, reflect back on your learning and go, I know where the refuge is, or I know what all of these agencies are for. And to be able to kind of step it up as a nurse and not just do the bedside care part, but to be the nurse that can also provide that full rounded holistic care, to also have some educated, informed conversations with your clients about anything that isn't just specifically bedside care related. So that is kind of in a nutshell my bio, my intro, why I think this is so important. I really like that this course is still online. I know that you've all done so much online education through COVID. In the past, we used to have students work at like food, what's the word I'm looking for? Food banks, soup kitchens, day programs. The challenge that we had with that was you only kind of got to see one population for the entire time that you were there. And you really missed out on how to work with the key kind of vulnerable and marginalized populations in Durham. So some experiences were much more engaging than others, and some were really focusing on things that you kind of have already had an experience with doing. So the thing that I do like about this course online is you get a chance to see all the key populations that I really want you to start to think about, to look into. It is not a theory course, so it's not a percentage-based scoring. It's a pass or fail. So, get in there, do the best that you can each week. The goal is to be hands-on, to be looking things up, to be thinking about your own experiences, to pretend that you're a public health nurse and I've given you these cases and your job for the day is to figure out what to do. That's what I do at home most days. My office is at home. I'm given questions from my trans clients all the time. How do I do this? And a big part of my job is to get online, to figure it out, to start to kind of navigate what the solutions may be. So that's how I've kind of written each week, is I've written each week almost simulating the job that I do, but for different populations. These are the problems as a nurse. What would you be able to find? What would you be able to do? So each week we are going to explore kind of some different context, some different content, all related to the same overarching goal, is to support you in working with folks that are vulnerable or marginalized. So what I'm going to do next is just screen share. Okay, so the screen that we are looking at, I'm not going to go through each week and all of the content, because you can find all of that, week 1, orientation, welcome back, week 2, homelessness and poverty. But I did create this assignments due tab as well, because I'm a master's student as well. I know as a student, it's so hard, especially in a 6-week course. You're jumping in, you're trying to figure out where everything is. And sometimes, that organizational piece can take some time. So although you're going to find these embedded throughout each week, I've also created this tab as like, this is your summary. This is what you need to focus on. So if your brain works in the way that you like to see it all on one page, it's also there. So week one, many of you should be, I see actually some students have already submitted it, but please know today is officially the first course day. So if you have not submitted it, that is okay. Week one, ultimately what you're going to be looking through is an initial, like, let's talk about health. What is community all about? And then I've created some case studies so you can start a scavenger hunt. And these are all case studies that are based off of real agencies in our area. So we've got folks that are looking for home care. Where do you begin to find those sorts of things? We've got folks that are working in the sex trade industry. Where do we send people that may also need help, finding services in and around that? I won't go through each and every one of them, but I will go through a few. We've got kids that are on the spectrum. And we've got parents that are looking for programs and centers and ways to kind of increase their social connections, but in a safe and appropriate space. Folks with MS, folks that are experiencing poverty, and it's impacting, their ability to work, as well as childcare options. So ultimately what you're going to do is take these cases, which is what I do every day for work. We take a family profile and then we figure out, how do we help them? So get on Google, start to search, services for sex trade in Durham region, open up the web pages, look at what they provide. The questions that are here are to help you answer some of the things that your clients would likely ask you if you were giving them these resources as well. So you can help them figure out, and these are things that you are, gosh, I have answered these questions a million times in my life. So these are things that, again, if you're at Emerge, if you're in PEDS, you're going to have a lot of these kind of embedded through your bedside care. So the case studies are just to get you looking at, what is our community? Ideally, I've picked Durham region. These case studies are based off of places that I know exist in Durham region because we're schooling in Durham. So my thought is likely we'll be providing care and clinical in Durham. But if you live in Toronto, if you live in Peterborough, and you're really interested in learning about the resources in your area, you are more than welcome to use the same case studies and look in wherever your community may be. I don't know if you'll find all the answers for each and every one. So of course, if you can't find that service, then look in Durham. But ideally, the goal is just to get you thinking about, how do you answer these questions? Because for each and every one of these, there are people, there are providers. And if I'm someone with a kid with cerebral palsy, I'm Googling the same thing, trying to find the same thing. So as a nurse, you want to have that knowledge kind of in your knowledge bank to be able to pull from without having to start from scratch. So that is week one. That is kind of the overarching goal. So just working through your case studies. And then at the bottom here, there's a few questions just to kind of get you, thinking about, who is your teacher? So it's myself, Nicole Morrison. Is there anything you're looking forward to in this course? And then this just helps me kind of understand, were you able to look through some of those key things in week one to find out those important things that I'm hoping that you can find. Week two is all about homelessness and poverty. So taking a moment to kind of reflect on, what does it mean to be homeless? And I know there's the theoretical definition, but what does it, what does it mean? We're thinking about the human context in this, the impact more than the definition. So, who is described as homeless? What do you think those factors may be that got people to that place? Very, very rarely, I don't know if ever, does someone choose to be homeless. So when we see people on the street and we hear folks saying, those awful things like get a job and these like simple blanket statement items, why do we think these folks are going through these scenarios? What contributes to people being in these positions? starting to kind of think about all the stories that get folks to being there is really an important part of understanding empathy and then how to work with them. If we don't know what got you there, we're not going to know how to support you. We're not going to know how to even begin to solve some of the problems if we truly think people can just go out and get a job. There's this much bigger issue, right? If you're a kid and you ran away from home because you're being abused and now you're homeless, you probably didn't go and knock on your mom or dad's door and ask for your birth certificate, your bank card, your social insurance card, all the things you need to have the ability to get a job, set up automatic pay, a place to shower so you're clean for your interview, a place to sleep at night so you can actually go to your job and function well. I want you just to kind of start to think about what are the contributing factors and what do you think some of those health challenges are? I'm also going to get you to work through a case scenario to kind of put yourself in the same shoes of folks that may be going through homelessness. So you are getting what folks get on OW, which is insane, the amount people get. It is nowhere near enough. So you need to figure out what sort of things are you going to keep in your budget? What sort of things are you going to get rid of? It's a really great this is taken off the homelessness hub scenario. So, starting to think about, like, would you pay for toilet paper or would you pay for laundry detergent? Are you going to pay for transportation to see your doctor, or are you going to pay for your kidney's new shoes for school? So you look at what you're going to get, and you kind of get to go through the same scenario, but in a much obviously safer way of, the decisions that people need to make to decide how they're going to exist and survive in this. So it's a bit of a hands-on experience for you to, to kind of put yourself in someone else's shoes. And then start to kind of look at, in our community, could you find rent? Could you find a room to live in? Look on Kijiji, look on Facebook Marketplace, try to find a room for the amount that's provided. And I think it helps you kind of contextualize in a different way what people may be going through when you do a bit of a simulation here on what some of those experiences may be. Working through that kind of barriers to just that simple statement we hear all the time that it hurts my soul when I hear people say that to homeless folks. Starting to think about kind of the things that we say versus the things that may be reality, because in nursing, we're not the general population. We don't make blanket statements. We say things that have background behind them. So I'm trying to help you kind of build some of that background in concepts we haven't really explored too deeply yet. I want you to take a look at kind of what the point in time count is if you can't find it. I've got a hint on where to find it. Start to look at the Housing First programs in Canada. How do we support people that are in this experience? And then a humongous part of community health nursing is learning how to advocate. So you write a little advocacy letter. It's not huge. 1 page is fine. Talking about how would you advocate for this community? What are some of the things that you think need to be included or changed? And then if you can create a poster as well for what are some of the resources that you found for the unsheltered population. So take a look in Durham. Where would you send someone? Where can you find food? Where can you find housing? Where can you find shelter? What are the parameters? A lot of our shelters don't let families stay together. We have like female shelters, male shelters. For my clients, what if you're trans? Where do you fit then? What if you're a collaborative couple that is living together? Where do you fit then? Take a look at the shelters in our area and get to know them, because you are going to have to connect people with shelters at some point in time in your career. Week 3. Harm reduction, my personal favorite. This is always a really interesting learning experience for students. Sometimes harm reduction can be, a challenging concept, something that we bump into and it might be uncomfortable, but learning the theory behind harm reduction. How do we argue the things that people say that don't have substance behind them? How do we get funding for this? How does it support OHIP? these are things that I really want you to take some time to look into. What is harm reduction, number one? You know, like safe consumption sites, bicycle helmet programs. We certainly like safe sex supplies. But we're going to kind of focus a lot on harm reduction in terms of drug policy, drug use, and getting to understand, because this is a huge growing area with the opioid crisis, and certainly an area that in nursing, many of you will cross or even possibly work in. So I've got some really great videos. They're short, but they really get you to see kind of that like street level. And this is where I'm happy it's online. You're never going to see the street level stuff in some of these placements, because we have to send you to safe placements, right? Places that are safe, places we know you're okay. Some of these videos really take you onto the street and share that like real human experience. The nurse that's working with these people, their real experiences. So take a look at some of these videos. They really kind of bring you to that ground level. And then I want you to do a debate. So if you're creating a debate, because you are going to debate this likely at some point in time, I want to get you to look up some evidence-informed facts to support the implementation of harm reduction. So tell me, you know, why harm reduction is important, why it's meaningful, why it benefits folks. And then you have to find 2 to 3 substantiated, evidence-informed reasons that it's not okay. Now, I will tell you, I've done this as well in a master's course. This is one of my first projects I did, and it was hard. It was so hard because to find evidence-informed reasons why it's not supported is almost slim to none. Please still look, please still dig, please still try to find a reason why harm reduction is just awful. But what I found was opinion. I found a lot of people's opinions, their thoughts on it, but I couldn't find a lot of evidence-informed information on the negatives. So look through the pros and the cons, summarize what you do find, and this is going to help you articulate well to people when you do have these topics come up. You getting to argue both sides of something is a great way to get us to think through kind of all areas. So your harm reduction debate can be a PowerPoint, you know, these are the pros, this is why, these are the cons, make sure that they're referenced. And then reflective practice. I'm really interested to hear, you know, did your perspective shift at all with what you learned? Did this help you explore it and look at it in a different way? Perhaps it did, perhaps it didn't. But often I find this is one of the most meaningful reflective notes I get, where students maybe looked at it one way and then kind of went, there's so much more to harm reduction than I really knew. Was there something that you took away from this that was a monumental takeaway? And then I've given you some references here to help you get started. I know that it's hard to find where to go and where to find everything. So I've given you some references already just to help you kind of get started. That is the end of week 3. So those are kind of your first big, you know, student week packages. This is to be, you know, in lieu of 2 8-hour days. I find the coursework takes, it certainly takes you at least 12 hours a week. Depending on how much you put into it, you can certainly make it the full 16, but make sure that you're leaving time for this, because it takes time, and that is the goal, right? This is in lieu of 2 days out at a soup kitchen. So just make sure that you're working through this, you're putting that time aside so you can work through them. After week 3, it gets a little bit lighter, because you are then going to start to work on your final capstone project, which is due in the end. You have a reflective note assignment that is due in the middle. And all of the due dates are posted in the Dropbox. They are accurate, they're up to date. So I will let you organize yourselves just looking at the Dropboxes. They are there. The reflective note is a little bit different than other placements. Sometimes I have students say, well, how do I write a reflection when I didn't meet a client? You can still absolutely reflect on your learning, even though you didn't do something hands-on, right? So your goal is to look at these guided questions here. So I've given you guided questions, so you're not following the models you may have in your other courses. This is a focused reflection, and I want you to answer questions about, like, what was your most meaningful takeaway from this course? Was there a perspective shift, or was there something that you really, you know, shifted your growth and learning on? Did you identify any biases? Was there anything that was hard for you during this? Was there anything that you walked into going, oh, I'm having a hard time supporting harm reduction or supporting homelessness supports or whatever it might be? Was there anything you kind of bumped into that didn't feel good, that you realized you had a bias? It's okay to enter with biases. It's human, it's normal. But the most important part is we identify our biases, and that's where we realize as nurses, we still have to provide care for folks. So unbiased care is imperative. So when we identify that bias, how do we push through to learn what we need to learn, to kind of work through those questions that are hard so we can still walk into a room and provide unbiased care? What do we have to do ourselves introspectively to get past that? So identifying biases isn't a bad thing as long as you work through them. You know, what nursing skills did you find you further developed? Did you figure out more about health promotion, or did you figure out more about advocacy? Is there anything that you want to continue to develop? Maybe you really need to learn more about a certain population or a certain community. I won't ask all of these questions here, but ultimately I'm looking at what did you take away from this course, is how is this going to help you in your future nursing career? There's always something that you take away from each course. And I try to look at your learning in this program like a puzzle. You know, in Matt Child, you learn something about a puzzle piece. And long-term care, I know you learn like your blood pressure and your vital signs skills, and maybe you started med and min. In your final consolidation, you probably got a lot of hands-on with wound care. Maybe you even saw code. In this one, you're going to learn something. And when you exit the program and you enter the nursing field, all of those puzzle pieces come together to create this like whole nurse where you can manage most scenarios that come your way. So you're not going to learn how to be a complete functioning, full, ready to go nurse from this course or any course. But what puzzle piece did you take away from this that's going to help you in the big picture is really what we're looking at in this assignment. Last but not least, the capstone project. The capstone project I really like because it gives you some autonomy. Perhaps there was something that we didn't explore in the first 3 weeks that you're really interested in. So you are going to pick a community or marginalized population that you are the most interested in. Perhaps it's gender and community health. Perhaps it's the 2S LGBTQI population, mental health, correctional health, adults with disabilities, STIs and AIDS. There's a number of there's a number of options listed there to get you thinking, but this isn't the only list that exists. If there's something that you're really interested in, perhaps, there's something that I haven't even added there that is relevant to you or your life or health challenges that you would like to know more about. So pick a community or a marginalized population that you want to know more about for your own learning. That's step one. Step two is to complete an assessment of the community. You can look at the windshield survey in your textbook, but again, I say, use this as a guide for potential questions. You do not have to complete the full windshield survey. But that's a great way to start thinking about, what do I know about this community? What can I see about this community? What can I find? What are the challenges for them? Not just the things we think, but start looking up what are the things that we can find that have evidence behind them. Create an assessment, what are some of the needs or gaps in this service? So I'm going to pause for a second just here to give you an example. I work with the gender expansive community in Durham region. So those are folks that are seeking gender affirming care to initiate gender related transitions. So my assessment would include things like looking up on Rainbow Health Ontario. What are the statistics? How many folks in Ontario are gender expansive? Getting to know what the population is, looking at what the services are out there for this population. What are the health challenges? So we have a Trans Pulse survey that is done that tells me what are the health challenges, what's going on, with this community. And I know in my community, we have decrease in services. We have high rates of mental health, like anxiety and depression in the early stages of transition. Our wait lists are humongous for people to look for care. And we have a lot of providers in Ontario that don't feel educated enough to take on this care to actually support folks. So my assessment would include some of that detail. That's what I can find. The gap in services that I may pick would be, providers and services to support people. It's really hard to figure out where to go, who is providing this care, how do I get, if I've got a youth, how do I connect that youth with like a crisis number or someone that's going to be gender affirming. So ideally you need to figure out your population and what's the problem. If I was a nurse, what would I be doing to kind of bridge some sort of gap that I can find in that? So then you're going to create some sort of health promotion materials. So today, actually, I'm working with my partner at my Trans Health Clinic to work on a letter for how to find a provider that does care in Durham region for this. So that's actually something that I'm actively working on. I'm creating my posters. So when I have people that are leaving our clinic and need to find a provider to continue that care, I can give them this poster and say, this is where you look. This is the website to take a peek on. These are the doctors we know that are doing this care. If you can't find one, these are the walk-ins that we know that are gender affirming. So you're going to do something for health promotion, whatever it may be. It's hypothetical. You're not actually going to go out and teach this community, but you're creating a health promotion material that would be used for this community to get you thinking about how a CHN nurse really works. So you're going to have a little proposal, who's your community, who's your population, just answering some of the questions in like a 2 to 3 page summary of everything that you found above. What are your plans to address the health needs? So I'm going to make a poster. How would I deliver this? In my world, it would be a poster that I'm emailing to clients as we discharge them. And then a little bit of self-reflection. Your final steps is to actually create that poster. So don't just give me the plan, but do it. Create a poster, create a PowerPoint. Maybe it's a lunch and learn that you're going to do for Emerge nurses on how to provide care for homeless folks. Or maybe it is a PowerPoint on mental health services for students in the Durham College campus. If you need someone to talk to, what are the services that are out there? What lunch and learn could you possibly create that could be shared? Some students do videos. I've had students do like exercise videos for seniors. They do a video at home, kind of showing me how they would do this. Be creative. If there's something that you want to do, this is kind of an open door. I've given you some examples, but I'm always interested in what your ideas are, what you may want to do, because certainly I am not the end all be all of options. I'm only providing you some examples to get your wheels turning. This is about your learning. This is about you walking away and feeling like, okay, now if I was working with this population, I know more about them. I know what the challenges are, and I know what I would do to support them. So that is your final assignment that is due. There are some resources down here, just some general resources on like harm reduction, just different standards of care, sexual health. Anytime I get something, I just kind of plunk it in there to help support you all in things that you might be interested in, but there is a vast array of other resources out in the world. Take a peek through them. If there's something that you need that you don't have, you can always reach out to me. I'm here to work with you. I'm here to guide you. So if you can't figure out where to find something, send me an email. I'm more than happy to point you in the right direction. And as you organize your due dates, everything is here. You can see when week 1 is due. So you are supposed to be working on this ideally Thursday, Friday. So everything's due the Monday. So it gives you a little bit of time to work through the content and then submit it. The only thing that I really want to highlight here in terms of due dates, and this is my last point, and then we will switch over to questions and just stop the recording so we have a chance to have some more conversations. The capstone project is due the very, very end of the day, our final day. I can actually change that to, I'll change that to 9 p.m. just to give you a little bit more time. But that's the last day the course is open. If you need an extension because something happened week 1, if you're sick week 2, email me. It's important that you communicate. I can provide extensions for extenuating circumstances. But that last and final capstone project, do not leave it until the final day to start working on it, to get it done. It's a big project and grades are due imminently after that. So you do have to get that capstone project in on time. So I can then translate your grade, export it, and get you over to your next course. So that is the only one where there is a hard line for that due date. It's a big project. Please make sure that you start it early. You have week 1, 2, and 3. Weeks 4, 5, and 6 are to work on that. So don't leave it until week 6 and then get started, or you will not get it done on time. I give you tons and tons of time to work on it. But in the past, I have had many students ask for extensions, and it is posted in our announcements here. It's very clearly written that there are no availability. There is no availability to extend beyond that date. So extensions will be denied if you need one for the capstone for those reasons. So always better to have a heads up, know the expectations, and just make sure you plan accordingly. I am going to stop the video now. So this can be posted for the students who have missed this, and then let's spend some time together answering questions that you may have. So just give me one moment. Stop my share.